Scott Peck's well-known book, The Road Less Traveled, states, "Life is difficult. This is a great truth, one of the greatest truths." Right now, life is difficult. We've been fighting the pandemic since March, and we are all tired. I am tired. Unfortunately, the virus is not tired. The scientists were correct when they predicted a fall surge. It is here. Yesterday, Lancaster County had over 200 positive test results. According to my records, our highest day was in the spring, was around 130 in early May. As a team member at Moravian Manor Communities, I've personally heard many of you speak to the pride you have felt as you've done your part to keep our residents safe. I've also seen staff members in tears as they struggle with the reality of the seclusion of our residents. There are no easy answers. The virus is spiking as we move to the end of the calendar year. Our favorite holidays are upon us. What do we do? How do we act? Recently, Jan Bergen, who's president of Lancaster General Health, shared some of the following challenges with LGH employees. I've edited some of her comments to share with you. With the holiday season approaching, our thoughts naturally turn to time with family and friends. Unfortunately, the rising number of COVID-19 cases challenges all of us to find meaningful ways to celebrate while ensuring the safety and health of our families, patients, and each other. Over the past week, there were 993 new cases of COVID in Lancaster County, a 40% increase from the previous week. Taking the effective and basic precautions, wearing masks, aggressive hand hygiene, and proper social distancing helps ensure that your family and the community we serve are less at risk. Additional steps our infectious disease experts recommend to contain the spread of the virus during the holiday season include: for travel. For everyone's health and safety, it's better not to travel. As cases continue to rise across the nation, avoiding hot spots has become very difficult, and travel requires breaking your trusted circle. If you are traveling by car, limit passengers to those in your household. If you're driving with anyone beyond your usual household, members or social bubble, wear a mask. While it's natural to gather with friends and loved ones to celebrate the season, it's essential to recognize these activities pose risks. Large gatherings should be avoided. Even small gatherings have been linked to infection transmission. To prevent the risk of infection, yet still enjoy personal connections, consider using virtual platforms to bring everyone together. Another healthcare provider is imploring their team members to avoid eating or drinking in groups, as this is a high-risk activity. Restaurants, bars, church services, and other large gatherings continue to be high-risk areas with low compliance. The words I am sharing with you today are not intended to be dictatorial, but suggestive. I trust you to be careful with your decisions in the coming weeks and months. My guess is that almost all of you know at least one individual that has now contracted COVID-19. As cases surge, we must find ways to summon additional energy to stay vigilant. The good news in the world is that there appears to be real progress with a vaccine. Also, for those who contract COVID-19, the current therapeutic treatments have improved, leading to a decreased death rate. For this, I am grateful. I am not desiring that any one of you live in fear. Mark Twain once said, "Courage is resistance to fear, the mastery of fear, but not the absence of fear." We all need an extra dose of courage these days. Thank you again for your heartfelt service to our residents. You guys are special people. I read a quote recently that said, "This is like being 16 again. Gas is cheap and I am grounded." Stay well, keep each other in your prayers, and make wise decisions.